Welcome dear viewers. Today we will be discussing about the brainstem and the medulla in detail. Even before going into the medulla, we have a small intro about the brainstem. So the brainstem, as you know, it is made up of midbrain. This is the midbrain and pons, and then the lowermost one is the medulla. So all the vital centers which will control your respiration, which will control your cardiovascular activities, and those which will control your blood pressure are located in this brainstem. So this brainstem is very important because all the vital organs are being controlled by this brainstem, all the vital activities. So the one which we are generally referring to as the brain's death is because of the damage to this brain stem. So if you all remember, all the cranial nerves will exit from this brain stem except the first and the second cranial nerve, that is except the optic and olfactory and optic. The remaining all cranial nerves, they will emerge out from the ventral aspect of the brain stem except the trochlear nerve. So trochlear nerve is the only cranial nerve which will emerge from the dorsal aspect of the brainstem. So in general, as a general rule, if you have to remember, the third and fourth cranial nerves will emerge from the midbrain, and 5, 6, 7 and 8 cranial nerves will emerge from the pons, and 9, 10, 11 and 12 cranial nerves will emerge from the medulla. So in today's class, we will be discussing in detail about the medulla. So when we talk about the medulla, we will be talking about the external features as well as the internal features. In this video, I will be talking about the external features of the medulla. So this is the medulla. Medulla, it will extend from the spinal cord at the level of foramen magnum, and it will extend up to the lower border of the pons. So it will extend from the upper part of the spinal cord at the level of foramen magnum and will extend up to the lower border of the pons. So medulla, it represents a truncated cone. So that is why it is also called as bulb. The other name for medulla is bulb. So medullary palsy is sometimes referred to as bulbar palsy as well. So that is because of its shape. So when we have to discuss about the external features of the medulla, we will be describing it under two views, that is ventral view and a dorsal view. So the one which is shown here is the ventral view, and the one which is being shown here is the dorsal view. So what are all the features we see in the ventral view of the medulla? So as I told you, it is a continuation of the spinal cord. So if you remember, in the spinal cord you will have a anteromedian fissure. So this continues above into the medulla as well. So this the ventral part of the medulla is being divided into two equal halves by the anteromedian fissure. Okay, and then lateral to that you have got anterolateral sulcus. Anterolateral sulcus. And even lateral to that you have got the posterolateral sulcus. So if you remember, in the spinal cord, actually in the anterior aspect you will be having the anteromedian fissure and the anterolateral sulcus. In the posterior aspect you will be seeing the posterolateral sulcus. But when you come to the medulla, you see the anteromedian fissure, anterolateral sulcus and posterolateral sulcus in the ventral view itself. So point to be noted. So the anteromedian fissure which is there will divide the ventral surface of the medulla into two equal halves. Now lateral to that you are having the anterolateral sulcus, and even lateral to that you are having the posterolateral sulcus. Now if you see carefully, in the upper half you are able to see one round and a oval elevation. This oval elevation. This is referred to as the olive. So the part of the medulla which is present between the anteromedian fissure and the olive, this part is referred to as the pyramid. So why this is called as pyramid is, this is formed by the cortico-spinal tract or the pyramidal tract. This elevation is formed by the underlying pyramidal tract. So this is called as the pyramid. And this olive which is there, this oval swelling which is there in between the anterolateral fissure and between the posterolateral fissure is overlying the olivary nucleus. So that is why it is given the name olive. So if you see carefully from medial to lateral side, you have got the anteromedian fissure, then you have got the pyramid, then you have got the anterolateral sulcus, then you have got the olive, then posterolateral sulcus, and even lateral to the posterolateral sulcus, this part is the bundle of nerve fibers which will connect medulla with the cerebellum. So that is called as the inferior cerebellar peduncle. So now if you have a careful look at this, the anteromedian fissure which is there, it is ending in a triangular depression at the lower border of the pons. So this triangular depression, it is referred to as foramen cecum. And lower down, if you are tracing this anteromedian fissure, it is becoming discontinuous. That is discontinuous. Why? Because there is crossing over of the lateral cortico-spinal tract. You know, 75% of the fibers of the cortico-spinal tract will cross over. So because of that crossing over, this anteromedian fissure is disturbed in its lower half. So this is about the ventral view of the medulla. So now let us have a look at the dorsal view of the medulla. This is the dorsal view of the medulla. So the central canal of the spinal cord will continue in the medulla for a certain extent and then it will open up. Thus you will have a closed part of the medulla and you will have a open part of the medulla. So this is the lower closed part of the medulla and upper open part of the medulla. So this upper open part of the medulla, it will form the floor of the fourth ventricle. So it will form a part of the floor of the fourth ventricle. So the features which you see in the floor of the fourth ventricle, I will be discussing it in detail in my video of the floor of the fourth ventricle. But as of now, please remember these points which you see here. So this is the median sulcus in the center, and then lateral to that you have got the sulcus limitans. So this sulcus limitans, it will join the median sulcus, thus dividing this medial eminence into two triangular halves. So the upper triangle is called as the hypoglossal triangle and the lower triangle is called as the vagal triangle. And lateral to that you see this is the vestibular area. And just below the vagal triangle you will be seeing an area which is called as area postrema. So all these form the part of the floor of the fourth ventricle. So this you can see it in the video of the floor of fourth ventricle. But as of now, the features you see in the upper open part of the medulla are, you see a median sulcus, then you see a sulcus limitans which is present lateral to that, and it will divide the medial eminence into two triangular. So upper hypoglossal triangle and a lower vagal triangle. So just below the vagal triangle you see one more area which is called as area postrema, and lateral most you will be seeing the vestibular area. So these are the features which you see in the upper open part of the medulla. Now coming to the lower closed part of the medulla. So this is the lower closed part of the medulla, and if you see carefully, in the center you are having the posteromedian sulcus. Posteromedian sulcus, which will divide the dorsal part of the medulla into two equal halves. Now just lateral to the posteromedian sulcus, you see one elevation. This is called as gracile tubercle. And lateral to this gracile tubercle, you see one more elevation which is referred to as the cuneate tubercle. So these from the center, if you see, you have got the posteromedian sulcus, lateral to that you have got the gracile tubercle, and lateral to that you have got the cuneate tubercle, and even more lateral to that you have got one more elevation which is called as tuber cinereum. Now how are these elevations formed? This gracile tubercle which is there, it will overlie the nucleus gracilis, and this cuneate tubercle, it will overlie the nucleus cuneatus, and the tuber cinereum which is present in the lateral most part is overlie the spinal nucleus of the trigeminal nerve and its tract. So the features you see in the dorsal part of the medulla is, you see the posteromedian sulcus which will divide the posterior part of the medulla into two equal halves, and then lateral to that you see the gracile tubercle which overlies the nucleus gracilis. Lateral to that you see the cuneate tubercle which will overlie the nucleus cuneatus, and even more lateral to that you see one more elevation which is called as tuber cinereum which will overlie the spinal nucleus of the trigeminal nerve and its tract. So these are the features you see in the lower closed part of the medulla. So this gracile tubercle will continue below as the fasciculus gracilis, and cuneate tubercle will continue below as the fasciculus cuneatus. So the cranial nerves in relation to medulla, as I told you, the 9, 10, 11 and 12 cranial nerves are related to the medulla. That is, they will emerge from the ventral aspect of the medulla. So from where do they emerge? 9, 10 and 11 cranial nerves. 9, 10 and 11. So that is vagus, glossopharyngeal and cranial part of accessory. So these will emerge from the junction between the olive and the inferior cerebellar peduncle. So that is, they will emerge from the posterolateral sulcus. So this is the posterolateral sulcus. So you see, this is the 9th cranial nerve, this is the 10th cranial nerve, and this is the 11th cranial nerve. 11th cranial nerve, as you all know, accessory nerve, it has got two components. It will have a cranial component and a spinal component. The cranial component will emerge from this posterolateral sulcus, and the spinal component will ascend upwards, and both of them together will join to form the accessory nerve. So this is the spinal component of the accessory nerve, and this is the cranial component of the accessory nerve. So the cranial component is emerging out from the medulla. Next, the 12th cranial nerve, that is the hypoglossal nerve. So the hypoglossal nerve will emerge from the ventral surface of the medulla from the junction between the pyramid and the olive, that is from the anterolateral sulcus. So this is the anterolateral sulcus. It will emerge in the form of 10 to 12 rootlets which will unite to form the hypoglossal nerve. So these are the nerves in relation to the medulla.